Hi, I wanted to give a little background into the introduction into health informatics and what is health informatics. So, as we look at what is the definition of health informatics as defined by the National Library of Medicine, health informatics is the interdisciplinary study of design, development, adoption, and application of IT-based innovations in healthcare services delivery, management, and planning. So basically, it's using technology and data to improve patient care. So, informatics in healthcare, it's been used for a very long time ago. Um, if we look at the stethoscope, which was invented in 1816 by Rene, French name, which I will not be able to pronounce, but you can see that there on the screen. What he did was he rolled sheets of paper to listen to an obese woman to hear her heart. So if you think about that, what might be the controversy back with the new tool back in the 1800s? One of the controversy is that they said that it took the doctor away from the patient. So the patient wasn't interacting with the obese woman who was sitting there on the bed. If you think about now in today's world, that happens. People say that with the use of the electronic health record system when the doctors or the nurses are interacting with the patient and looking down at the computer screen, that they're not interacting with the patient. Also, back then, he was a surgeon, so surgeons at that time were also thought less than, which is much different than today's world. But just to give you a background on how the stethoscope compares to the electronic health record system. Some of the history of health informatics dates back to Hippocrates back in the 5th century BC, in which he stated that the patient's disease should be documented as to the course and also the probable causes of disease. In 1850s, during the Crimean War, Florence Nightingale, of course, one of my heroes in nursing, me being a nurse, she documented the poor sanitations for the soldiers and way to improve it. So if you're looking at data, she looked at the data and looked at how many soldiers were dying due to infections that were simply um, could be prevented by just the mere use of hand washing. In the 1940s, ENAC, which was the first general purpose computer, was introduced. It was housed in a huge room, so if you can see that little uh, screen there, picture shows how big that computer was. In the 1950s, healthcare first started using computers. Ledley and Lusted theorized to be helpful in medical diagnosis, in which they can archive and process information more readily. In the 60s, Medline, which contains journal citation abstracts from literature from around the world, was first started being introduced and people started using it. Now we use it a lot. I know I've used it a lot as a nurse doing my research and looking at information. Also emerging during that time frame was electronic health record system, in which it was first started being used at academic medical centers and government healthcare centers to help improve patient care. In 1970s, artificial intelligence was introduced along with MUMPS. MUMPS is the Massachusetts General Hospital Utility Multi-Program System, which is a mouth word full, and it was the first type of program language with a built-in database. It is still currently used today. Epic system, which is currently being used at the University Medical Center uh, campus, they use Epic and they use this type of language in their processing and their programming of their software. In the 1980s, one of my favorites, the Atari, I was first introduced by my uncle by the Atari system and was able to play games on our TV, which provide hours of fun. I don't know how many people have played Pong or Pac-Man, and this was the time that was first introduced. Then in the 1990s, mobile technology like Palm Pilots, which provided, that first type of mobile technology. Now we have Apple iPhones and Androids and a variety of different technology that we can use today. But this was first introduced in 1990, which really isn't that long ago, and now it's almost obsolete using the Palm Pilot. Um, and then in 2000, the Human Genome Project was started, which is an international project to identify and map all the genes which make up the human DNA. So when we look at the American Recovery and Reinvestment Act, in 2009, it was first signed into by President Obama, which was the Healthcare Information Technology for Economic and Clinical Health, which is the high tech. This is really big for health informatics and also big for healthcare in general. One of the things that they did was they gave financial incentives to hospitals and providers who demonstrated meaningful use. This is why there's been such a talk about using electronic health records, and also why hospitals are using more and more of implementing different types of electronic medical records. So there's different informatics domains I just wanted to touch on just for your own information. There's nurse informatics, which has held the longest record for holding training in informatics with core competencies within the field of informatics. Next comes physicians, who's also been practicing in the domain but didn't really quite develop the core curriculum until more recently. So this is also called medical informatics. And some of these terms are used meaning denoting the same thing. So health informatics, which I'll also talk about, people, physicians can belong to, be also called health informatics, and such as nurses. And then we have pharmacy informatics, with the adoption of CPOE, or the computerized physician order entry. Pharmacy informatics has also increased, and they also started developing their own core curriculum. So, in different electronic health record systems, there's a team of different informatics that help promote the use of electronic health record system in the data that contains. And so you might have nursing informatics or physician informatics or medical informatics or pharmacist helping all with the design and training and development of workflows. And then when we talk about health informatics, it's much more in broader term, and it encompasses all of that. Information architect is what type of information is put into the system to make sense to either the patient, consumer, the nurse, or the provider. For instance, if we put a data point of 102.7 as a number into the system, well, if you didn't know what that meant or what that pertained to, then you wouldn't know what that means. So one of the things that you want to make sure is that when you put information into the system is that it can be extracted out. So if you put 102.7 degrees Fahrenheit and you put that belongs to a patient called Mr. Smith, that it was his temperature put in on yesterday's date of whatever date that is at 0800, then it would make sense that when the nurse goes in to see that information, or when the doctor goes in to see that information, that Mr. Smith actually has a temperature and needs to be treated for that. So whenever we use any kind of system, we want to make sure that the system or software is usable to anyone that interacts with the system. So what information gets put in, the consumer can find that information, whether the consumer be the patient, nurse, the doctor, anyone that interacts with that type of system. And then usability is crucial in the design and implementation, the adoption and use of clinical products. Good usability results in products that are effective, efficient, and satisfying to use. So, what does this all mean to you in your healthcare? Is when you're providing the leadership in healthcare administration, is making sure that you validate the data, whether it's you or somebody on your team. Make sure that somebody validates the data and what gets put in can be extracted out. You also want to verify that all participants have the same information. So if we only give a certain view to the nurse or the doctor, so the nurse may know that this patient has a temperature of 102.7 Fahrenheit. The doctor may not be able to see that. So we want to make sure that what the nurse sees, the doctor can also see that so that they can provide the patient with the best possible care. We also want to make sure that that participants may have different knowledge. So what the doctor sees and what the nurses see may be two different things, and they also want to make sure that they have the necessary tools to make that judgment and to make sure that the patient is taken care of. And also, we want to ensure that the wisdom, what is best for the patient and consumer. So that's it for the basic introduction, and we'll get next into the electronic health record system.